Hello and welcome everyone. You're listening to Health Insurance 411. My name is Steve Stump. Thank you for tuning in today. If you haven't already liked this video or subscribed so that you can watch future videos, please do so. I try to publish one each day at 4:11 p.m. That's Central Time. Sorry, I can't handle across the time zones, but that's why it's called the Health Insurance 411. Hey, today I wanted to talk about the biggest question I get from my clients is how much health insurance should I get? Now, keep in mind, I work with a private insurance option, doesn't have to be compliant with the Affordable Care Act, and therefore you get to choose how much health insurance you want, what your limits will be. But I get the question a lot, and I want to put it in context to the broader industry. So let's talk about the marketplace plans. Now, these are the plans that you can go get at healthcare.gov. They are Affordable Care Act compliant, and they have unlimited benefits, meaning that no matter how much health care you get within the year, the plan will pay for that health care once you exceed all the limits, like your deductible and like your out-of-pocket maximums. Now, a lot of people think that that's what they need, but in reality, it's very unusual that you have that much healthcare needs within 1 year, because keep in mind, every year, those limits all reset. But it's very unusual that you should even have $1 million in healthcare needs within a year. You see, there's this concept inside insurance industry called reinsurance. And there are companies that basically stop the loss of insurance companies through reinsurance agreements. And these companies, one of them is Sun Life, looked at the medical claims in 2017 and 2019 and evaluated how many $1 million plus claims happened in those years. And in both years, it was just around about 200 $1 million plus claims. So it's very, very unusual to have that much healthcare cost in 1 year. And I guess if you think about it, if you reach that level of expense in your healthcare, you're probably in pretty bad shape, and you may not have made it through the year. I mean, let's just be honest. You spend $1 million in healthcare, you were fighting something pretty serious, and certainly probably fighting for your life. So one of the questions I get is, well, if I don't want unlimited health insurance, how much insurance should I get? And this is the analogy that I use to explain it sometimes. If you buy a Ford Fiesta versus a Ferrari, you're going to insure for a Ford Fiesta. But if you go buy a Ferrari, you're going to insure for a Ferrari. The difference is about $20,000 in the cost of that car versus exceeding $200,000 or even more in the cost of that car. And so you're going to insure for the automobile that you purchased. Well, you can do the same thing with your health. Now, if you're an extremely overweight individual, you have chronic conditions, maybe a recent cancer diagnosis or a recent heart attack, then buying the most amount of health insurance is going to be important. Maybe going with an Affordable Care Act compliant plan through the marketplace where you have unlimited benefits once you reach your limits is the best option for you. However, did you know that 5% of our population accounts for 50% of the healthcare expenditures in the US? So flip that around. 95% of our population accounts for the other half of the healthcare expenditures. So you don't need to be a super fit athlete to think about what's the right level of insurance for your situation. You simply need to be in that 95%. The other way that you can think about it is how many times in a year do you go see a doctor? Many of us never go see a doctor, or perhaps we'll go just for our 1-year annual visit. Other than that, we might get a cold and sniffle every once in a while, but we really don't get sick. So in that situation, you can actually lower your health insurance cost by going a private insurance option and then choosing the level of benefits you want within a year. And this is how I hope people understand what the level of benefit might need to be. Now, it's going to depend on your health insurance plan that you're looking at, but you're probably going to be looking at a couple of options, probably a $250,000 option of benefit per person per year, a $500,000 option of $500,000 in benefit per person per year, or $1 million in benefit per person per year. So what I typically help people understand, if you are in your 20s and you've got no family history of medical issues and you've never had any big medical issues in the past, but you're trying to stay within a budget because you're in your 20s and you're just beginning your earning career, then a $250,000 benefit per person per year might be a good a fit for you. If you're in your 30s, I typically, especially late 30s, early 40s, I typically suggest at least a $500,000. And then 40 and plus, I typically suggest that if you want peace of mind, that should the worst diagnosis happen to you, then you've got the most amount of benefit in that year, knowing that there's about $200 million plus claims in any one year, then $1 million benefit per person per year is probably the best fit for you. Now, one of the things you should ask your agent when you start to look at your private insurance options is what other policies can they bundle in with your core medical policy. Some of the options will be an accident policy that will pay for the cost of care related to that accident. Now, some of them will be a fixed benefit schedule. So depending on the type of care you get related to that accident, it will pay certain benefits related to the care that you get based off of the schedule of benefits. Others will have a flat amount that regardless of the care that you get, it will have a flat amount that it will pay and it won't exceed for any care related to that accident. They may have accidental death benefits. They may have an indemnity, a hospital indemnity benefit, where for each day that the accident puts you in the hospital, it pays some amount of money to offset the cost of your hospital stay. So that's number one. Ask your agent what accident policies you might be able to bundle in your bundle with your core medical policy. Now, the other policy to consider is what happens when you get a dreaded diagnosis. The big three that everyone's always concerned about is a cancer diagnosis, or you have a heart attack or a stroke. And then will your coverage be enough? Well, one of the things that you can do is you can bundle in other policies like a specified disease policy or a critical illness policy that will pay out in addition to your core medical policy when you are diagnosed with the specified diseases listed in those policies. And so this can be a way to say, have a $250,000 medical policy, but then another $250,000 or maybe even a $500,000 or even $1 million in additional policies related to your specified disease diagnosis. And then lastly, talk with your life insurance agent. So here's the reason being. Life insurance policies can be structured so that you have living benefits while you are alive, so that you can actually tap into the value of that life insurance policy while you're alive. These living benefits are typically triggered because of some critical diagnosis that you get from some dreaded disease. Should you become disabled, should you have a terrible injury that disables you, and it meets the definition of the payout of those living benefits. And so adding an accident policy, adding a specified disease critical illness policy, or adding a life insurance policy with living benefits can be a way to add more coverage for your health insurance needs or healthcare needs, so that you don't have to go into the marketplace, purchase a plan with unlimited benefits, because unfortunately, when you do that, you're going to be paying for those unlimited benefits. And nowadays, way the insurance companies structure these plans is a lot of the burden is put on you to be able to pay your deductible and reach your out-of-pocket max limits before the plan actually starts to pay anything. One of the things I do is I help people understand that the health insurance and healthcare industry is actually rigged against you. And it was all formulated and structured with the passage of Obamacare and the Affordable Care Act. And it was meant to prop up that entire industry because, like I said, 5% of our population creates 50% of the healthcare expenditures. So the government realized we need to put a lot of healthy people into these health insurance plans. Well, it's rigged against you. And now there are ways for you to basically rig that game in your favor. And that's what I talk about in my video. You just go to www.insuremesteve.us/rigged, provide me a little bit of information about yourself, and you'll have access to the video. I'd love your thoughts on what you took away from the video. Feel free to put it back in the comments below, or DM me, email me. My phone number is on my website. But this has been Health Insurance 411. Stay tuned for tomorrow because I got more fantastic content where we're going to be talking about health insurance and topics that are relevant for you. Have a great and fantastic day.